Okay, hello, my name is Hanan Bashir, and today I will be asking you some questions about healthcare leadership for my healthcare administration capstone course. So you can go ahead and start by introducing yourself.
Sure. My name is Dr. Suleiman, and I'm a chiropractor. I've been in private practice now for just about 16, 17 years, and I have a degree for my undergrad in cell and molecular biology from the University of Toronto, and now I'm a practicing chiropractor in private practice.
Oh, great. So I'll go ahead and start with the first question.
Sure.
Why did you pick this career?
For me, Hanan, choosing chiropractic as a profession was actually it was a very personal experience. It was not research driven. It was something that happened to me when I was growing up in Canada. Every Canadian teenager and youngster plays hockey. Hockey is a religion in Canada.
Oh, wow.
So I played hockey against the players that were a lot bigger than me, double my size. I was discouraged by my mother and father from playing hockey when they saw the size of the other players on the ice. And I took a check in the boards, and my right shoulder was really messed up. I had been shuffled from orthopedist to medical doctor, and the only treatments that were being offered to me were medicine. Steroid drugs, steroid shots, anti-inflammatories, and I struggled. It didn't get better. It didn't resolve, and I used to. It's a personal story.
Right.
I used to cut my neighbor's grass when I was a kid. We shared a common front lawn area, and he saw me struggling cutting his grass, and he was the one who actually mentioned to my father and to myself that we should pay a visit to his nephew, who was a chiropractor, Dr. Keshevji. And we didn't know. I had no idea what a chiropractor was. I'd never heard of a chiropractor. My father didn't know, but we decided nothing else was working, so we said, let's give it a shot.
Yeah.
Went to see him, and he was the first doctor in this whole experience that actually showed me a model of a shoulder.
Wow.
He showed me the bones, the humerus, the scapula, where the articulation is, the muscles of the rotator cuff. And he was the first doctor to actually explain my condition, what was going on. And he said, take those drugs, take those medications, throw them in the trash. We are going to treat this with exercise. We're going to treat this conservatively with ultrasound, electric therapy. He says, if you follow my treatment protocol, you'll get better. And I followed his treatment protocol, and it worked. So for me, I was less impressed with the fact that it worked, but more impressed with the way that he handled the whole situation. The way that he used, absolutely, the way that he educated me and made me aware of what's going on, which muscle am I using, and I've incorporated that into my practice today, where when I have a patient here, nobody leaves this office without understanding their condition. In other words, I will never give a patient a diagnosis without them understanding what that diagnosis entails. When a patient understands their condition, they respond to therapy. When you just tell them you have arthritis, where you're sitting, that's where I conduct my initial patient interviews. When a patient comes in and they tell me they have arthritis, I ask them, what is arthritis? And they'll look at me and they'll have this dumbfounded look like, I don't know, but I have arthritis. You need to understand what the condition is. Doctors need to explain to their patients. So for me, again, it was a very personal experience.
That's awesome. That's a great story.
Yeah, and then once I graduated, of course, all my family members are all medical doctors. My uncle is a cardiologist at McMaster Hospital. He's one of the top, Canadian cardiologists.
That's nice.
And I really was gearing towards medical school when I graduated with my degree in molecular biology. But again, the model didn't work for me. The medical model, the Western allopathic approach to treatment of disease didn't jive with my way of thinking.
So something related to the same question. If you have to choose this career again, would you?
Absolutely. 100% I would choose this career. And the one thing I love about my profession, and people look at me kind of like I'm crazy when I tell them this, but I love the fact that it's an uphill battle. Chiropractors get very little respect in the general population. Chiropractic has always been seen as alternative or quackery even, as a very negative kind of, view of the profession. And it's like sometimes you're like a salmon and you're fighting that uphill battle. You're always going upstream against the current. And I don't mind it. I like the challenge because if everybody just accepted what I said and did exactly what I was doing and there was no challenge, I think then, I don't think that would have that, appeal for me, the excitement. Exactly. Absolutely. And I love it because I can get patients that come in here and I can talk to them, or I can go out there. I do a lot of outreach. I go to public schools when it's career day, and I'm proud to represent my profession. And I'll be honest with you, there have been chiropractors in the profession that have given chiropractic a bad name. Back in the 80s, there was a lot of, unnecessary treatments that were done, excessive amounts of treatment. But I say that there are good and bad in every profession. And you have to look at the basic principles of what that profession entails. The principles of chiropractic are wonderful. Treating people conservatively without running to drugs, without running to surgery. Now, sometimes drugs are necessary, sometimes surgery is necessary, but sometimes things can be treated very conservatively. So that's the whole approach. It also is in line with my roots, which are of an Eastern background. So the Eastern philosophy of healthcare is strengthen the host. The Western philosophy of healthcare is fight the disease. So it makes much more sense to strengthen the host so that your body, one of the primary principles of chiropractic is that your body has an immune system. Your body has the ability to fight whatever comes into it. Your body has the ability to fight disease if you make your body strong enough to be able to do that. So the focus is on prevention. Thomas Edison, one of the greatest minds and thinkers of our time, he said it, the doctor of the future will give no medicine, but will instead be concerned with framework and structure of the human body and in the prevention of disease. Focused on prevention, focused on structure of the human body. So,
moving on to the next question.
Sure. I'm gonna just have a sip of coffee.
Go ahead. What is your leadership style, and what experiences, whether good or bad, impacted the way in which you lead others?
Leadership style, that's a very interesting question. And leadership style, it differs for every patient that walks into the door. This is a service industry. Healthcare is a service-related industry. And first and foremost, my job is to provide a service to my patients. The leadership style, the leadership quality will largely be dictated by the type of patient that comes in. In other words, if a patient comes in and let's say they are lacking in motivation, let's say that they don't want to do exercises, they just want to be a passive participant where they lie down on the therapy table and get the electric stim done and the ultrasound, and a passive participant, and they don't do the exercises, they don't modify their diet, they don't try to quit smoking or change these sorts of things in their life or make lifestyle changes, then my leadership skills and my leadership type at that point would have to be more of a, I don't want to use the word paternal figure, but it's to kind of like, okay, listen, I've got to whip this person into shape. I've got to find a way to motivate them, okay? Whereas if I have a patient that comes in and let's say they're an athlete and I need them to rest, but they don't want to rest because they're like, they want to work out in the gym 6 times a week in the gym. For me to tell them that, hey, listen, you need to understand that your body needs to recuperate, your body needs to have a few weeks off to rest, then my leadership skill at that point in time will transition to more of a, let me educate the patient and explain to them about tissue healing and about how, you've got to let the body heal first before you go and do further injury, further damage. So it really differs and is based on the type of patient that will walk through my door. And everybody is an individual. There are no 2 patients in my career over 20 years that have been exactly the same. Everybody has different types of things that motivate them. A lot of my patients will come in, and if they have, a herniated disc, a lot of them come in with anxiety that's superimposed on this, herniated disc. They're thinking, oh my God, I'll never be able to golf again, or I'll never be able to do my job again. I'm going to go on disability. My family's going to suffer. At that point in time, I have to certainly address that anxiety issue. I have to be a calming figure. So my leadership roles at that point would be, let me try to calm this patient down and reassure them. Okay, not every patient needs reassurance. Some do, some don't. Again, every patient is an individual, and the way I'll approach them will be different based on the patient themselves. And that's why I think it's helpful. I didn't mention in the beginning when I did my introduction that I did a minor degree in psychology. I'm not a psychologist. I don't pretend to be a psychologist.
Yeah.
But certainly having a background in psychology and understanding the human psyche, that definitely helps. Also, it's impossible to separate, the mind and the body, the connection between the two. If a patient is experiencing, chronic pain and they have depression as a result of it, you're only going to be only so successful at treating the herniated disc unless you address that other component as well. So to see the person as a whole person and not just in compartments and see them, okay, well, this is that aspect. You have to see the whole thing. That's why chiropractic is known as, being holistic healthcare, where you see the human as an entire sum of all their parts and pieces. Yeah, holistic.
Interesting. Yeah. Oh, that's great. Okay, thank you.
Oh, you're welcome.
Our next question is, what do you find most admirable in people?
One of the traits that I find most admirable in people is resilience. When people can overcome great obstacles and people can overcome great odds, and whatever life throws at them, they just pick themselves up. It's okay to fail. It really is okay to fail. I'm a father of 2 children. I tell both of my daughters, failure is good. As long as you learn something from failure. If you don't fail in life, it means you're not trying. It means you're not trying new things. You're not learning anything new, and you certainly aren't putting yourself out there to try new things. Anything that's new to you, you're not going to grasp it immediately. You better be prepared to fail a few times. When you go downhill skiing for the first time, yeah, you're going to go home with a lot of bruises, right? Maybe even a broken limb, right? But it's a part of it. It's a part of acquiring a skill. So resilience is something. When people get back up, dust themselves off, and say, I'm going back at it, and I'm going to try it again, to me, that's a wonderful characteristic. Those people succeed, ultimately, in whatever they choose to do. If you persevere, you'll achieve it.
Why do you think that's important?
It's important to me because I've lived my life like that. I've had some obstacles along the way, and I won't let obstacles, set me back. You have to be willing to say, okay, well, you know what? When I opened my practice 15 years ago, I was nervous as anything. I wasn't on any insurance panels. I wasn't a participating provider. Nobody knew who I was. And I remember going out in July and August in 95-degree heat, door to door, handing out flyers, knocking on doors in my area here, my office complex, to introduce myself. And part of me thought in the back of my mind, wow, I'm a doctor. I really shouldn't have to go out there. I don't think any other doctor that I know of, pediatricians, internal medicine doctors, neurosurgeons, I don't see them going out there and knocking on doors, having to introduce themselves. But as a chiropractor, I'm like, I have to do it. And again, that's that upstream battle that I talked to you about. That's the challenge. And I didn't mind it. At the end of the day, if I got one new patient out of it, it was worth it. If there was one person that I could help that ended up coming into my office because of my efforts and I was able to help them, then it's well worth it.
Yeah. Who is your favorite leader and why?
My favorite leader, I am a huge fan of Bill Gates. Barack Obama is another one, but you asked me for one, so I'll go with Bill Gates. And Bill Gates, for the reason that he is a philanthropist. He believes in helping out his fellow man. Number one, he's an incredible innovator, coming up with a whole operating system and changing the way we do things on a daily basis with the advent of computers and operating systems and all the stuff that goes along with it. But he's a guy that could very easily now sit back and just enjoy the rest of his life. He's still a very young man, but he's made it his goal to go out there and eradicate malaria in Africa. He's gone out there to make it his goal to make sure that children and I hate to use the word third world because I think we all have one world. I don't think there is a third and a second world. So I'd rather say in the less developed nations with lesser amount of infrastructure, he's made it a goal to go out there and help them in terms of the fields of education, in science, in giving them the ability to at least be competitive on a global level. And here's a guy who, could, like I said, very easily just sit back. And one thing I read about Bill Gates recently was that he is leaving his children not a huge substantial, it's like a small percentage of his net worth, what he's leaving his children. And when asked about that, he said that he doesn't want to do that because they could become complacent. In other words, by not giving them this huge inheritance, they will work harder and they will become innovators. Sometimes when you've been given everything, then you don't value it. You take it for granted. Absolutely, you don't value it. And again, that goes back. I like challenges. And I think what he's doing is he's setting up challenges for his children so that they will reach their maximum potential.
Absolutely.
Yeah.
That's the best thing you can do for your children.
Absolutely. Absolutely. I mean, some parents want to just spoon feed their kids and give them everything because, especially if they were deprived of something. Psychologically, again, when a parent grew up in hard times, they're like, I don't want my children to go through this. But sometimes those hard times are what make you. They make you great, So. Can we pause for one moment? I'm just going to go check my patients.
Sure, of course.
I'll be right back, okay? I'm just going to go check my brother.